Hi, I'm Maggie Gregg, and I'm an athletic trainer with U of L Health. I was an athlete growing up, so I always loved just being around sports and stuff, and my mom's actually a doctor, so I always was very interested in the healthcare field. And when I got to college, I kind of found out about athletic training and it seemed like it was a perfect fit for me to be involved in the journeys of other young athletes. Right now, I'm working with athletes at the high school level, and it can be anything from cross country to soccer to basketball, volleyball, anything. I see all types of injuries, a lot of chronic injuries or like those ACL tears and things like that happen in sports. So my main duty is to just be there for when an injury happens and also just help promote the general health and well-being of all my athletes so that they stay healthy and prevent injuries. My biggest, consideration when caring for patients is really just establishing a really good level of communication and a good relationship with them, because when dealing with high schoolers especially, they don't always know what an athletic trainer is there for, and you kind of have to be there to establish a relationship, let them know that you're there to help them and to keep them safe and keep that communication open so that they want to come to you. I think something that I use a lot is that I was also an athlete growing up, and I can relate to a lot of what they go through. I had so many injuries myself, and a lot of times I can, tell them I went through this and this is what worked for me, but what might work for you might be different, and we can just work on it together and kind of have an open relationship there. I'm like a really huge college basketball fan, especially U of L. I went to U of L for my undergrad, and I just have always loved basketball. I go sailing a lot with my dad on the Ohio River.